It's 7 o'clock. This is Sky News Tonight. Our top story, a red alert for the new COVID variant from health officials. A new risk analysis of the Omicron variant gives more details on how easily it might be transmitted and whether it could evade vaccines.
Prime Minister, should people go ahead with Christmas party plans? Will you be having a Christmas party, Prime Minister?
A thumbs up from the Prime Minister over whether festive celebrations should still go ahead, but cases top 50,000 for the second day in a row. While coming up, we'll be trying to answer all your pressing questions on the Omicron variant with our panel of experts. Also tonight, a father and his partner are jailed for abusing and killing 6-year-old Arthur Labinjo Hughes. The entire coaching staff at Yorkshire County Cricket Club leave in the wake of Azim Rafiq's racism allegations. The FA apologises after a review says lives could have been lost when fans stormed the Euro 2020 final at Wembley. More than 4 years on from the Grenfell fire, we speak to leaseholders desperate for help to make their buildings safe. And we chat to Oscar winner Olivia Colman about her latest role as a real-life murderer. A very good evening, I'm Jonathan Samuels. The Omicron COVID variant is still providing more questions than answers for scientists tonight, but new analysis from the UK Health Security Agency has started to fill in some of the gaps in our knowledge. It's issued a red alert on the variant, on its ability, in theory, to evade both vaccines and naturally acquired immunity. But scientists stress any predictions are difficult to be sure of at the moment. Meanwhile, the general UK COVID situation continues to be of concern as daily cases passed 50,000 for the second successive day, all of which poses another set of questions for politicians, with the Prime Minister again pressed today on whether Christmas celebrations should go ahead. Well, coming up, we'll be speaking to our panel of experts who will be on hand to answer your questions. But first, let's get a bit more detail on what new information we've got about Omicron today. We can speak to our health correspondent, Ashish Joshi. So, Ashish, scientists racing to understand more about Omicron. What is the latest?
Well, every case, Jonathan, will give our scientists and researchers a little bit more information. And when you have a cluster of cases, it gives you an indication. But I ought to stress right now that this is just too small a data set to form any judgments on. This gives us indications. It gives us an idea of the way that this variant might be behaving. Let's go through some of those numbers that have been given to us by the UK Health Security Agency. It says 12 of the 22 known cases up to November the 30th had been fully vaccinated. So that's almost half, right? That's 12 of the 22 known cases. That's over half the cases had been fully vaccinated. Another 2 had been given their first dose at least 4 weeks earlier. 6 were unvaccinated with no data available on the other 2 cases. So just that small sample shows you that a large number of those people who had Omicron were vaccinated, were double vaccinated as far as the 12 were concerned, had been fully vaccinated, and the other 2 had been given their first dose. So on the surface of it, they are quite concerning, those numbers, because you would have thought that the vaccine would have offered you more protection against Omicron. But I ought to stress that this is a very small sample. These are 22 people. Then it goes on to say that the UK Health Security Agency says there is a strong early signal of Omicron cases in the UK, and that it knows from the PCR tests it's conducting. This is looking for an S gene dropout, which is indicative of Omicron, but also some other variants. But certainly the early indication is that there is a rise in the number of Omicron cases. And the signal, the red alert you were talking about earlier, it says the UK HSA has given the highest red alert against the virus. Again, we want to stress for its theoretical ability based on mutations to evade both the vaccine and naturally acquired immunity. And it also says the risk assessment gives it an amber alert for transmissibility, which is expected to be at least as high as other variants currently circulating. But it also goes on to say, and remember, this is for the period up to November the 21st, monitoring of wastewater has found very little evidence of Omicron. You would expect that to increase as more cases are found. So on the surface of it, it does seem like there is a degree of vaccine evasion in this variant, and that would seem to be what is suggested by the data in South Africa too.
OK, much more work to be done before we have a full picture, of course. Ashish, for the moment, thank you. Well, we can take a look at the latest daily COVID data now. There have been 50,584 new cases of COVID-19 recorded in the last 24 hours. Another 143 deaths have been reported within 28 days of a positive test. And that brings the total number of deaths in the UK to 145,424. Now, 25,848 people received their first dose of a vaccine, while 30,976 people received their second dose. That means the total number of people to have received their second dose is now more than 46.4 million. And 420,910 booster and third jabs were given in the latest 24-hour period, taking the total number of those doses to more than 19.4 million. Well, the nationwide infection rate now stands at 440 weekly cases per 100,000 people, virtually unchanged, in fact, from a week ago. The place with the highest case rate is still Torridge in Devon, with 1,059 cases per 100,000. Aside from the Scottish Islands, the place with the lowest rate is Carlisle in Cumbria, 223 cases per 100,000 people there. Well, routine health checks for over 75s may be deferred because of the pressure on the NHS caused by plans to accelerate the COVID booster programme. It comes as ministers face more pressure on whether Christmas parties can go ahead in the face of the new Omicron COVID variant. Ministers have today insisted that people should carry on as normal, and the Prime Minister gave a thumbs up when questioned on the issue in Downing Street. In the past hour, the Prime Minister has been speaking about the variant and Christmas. Let's have a listen.
On the subject of Christmas parties, I noticed there's been quite a lot of toing and froing about it. People concerned that they need to cancel their Christmas parties. That's not right. We're not saying that, and we're not saying that nativity plays have to be cancelled. I believe very strongly that kids should be in school, and I also think that that Christmas should go ahead as normally as possible. What we're trying to do is cope with the Omicron variant, and that means having some tough measures at the borders, and also some measures to make sure that people isolate if they come in contact with an Omicron case. Plus, we're toughening up the measures on masks, and that's a balanced and proportionate approach to take to Omicron, whilst we wait to get to the bottom of exactly the risk that it poses. But key point, whatever the risk Omicron may pose or may not pose, the booster is everywhere and always going to be, or vaccination is going to be, your best protection.
Our correspondent Ali Fortescue is here with me in the studio. The Prime Minister speaking in the last hour or so. Ali, pretty much carry on as normal when it comes to Christmas planning. Of course, there is this huge push, isn't there, now for the booster programme, and there is concern that that's going to divert NHS staff away from what is always a very busy period. Yeah, that's right. And I think all week we've heard warnings from GPs about staff shortages. We know that the government want to vaccinate 500,000 people a day as part of that ramping up of the booster campaign, right back to where we were at the height of the first rollout of the vaccine. So obviously that's an enormous logistical challenge, and things are going to have to be moved around. And we've seen a letter from the NHS today that's been sent to GPs, to psychiatrists. It says that routine checks for over 70s could be deferred, which I think has prompted some concerns, because obviously there's already a backlog, there's already worries about staff shortages. But I've been told that face-to-face appointments still going to be able to go ahead. So if someone over 75 has a worry, they will easily, I'm told, be able to book an appointment. And I've also been told that some non-urgent procedures could be suspended. The examples I was given were things like
routine weight checks for people with serious mental health illness, that could be suspended, or the way that asthma is diagnosed, where you have to have 2 diagnoses. So some things could be pushed back for the next few months until the end of March, is what we understand. But the Royal College of Psychiatrists have said that these are sensible and temporary measures. But I think there is definitely going to be a focus in the next few weeks over how the NHS copes with this massive booster campaign when it's already under a lot of strain in the winter.
Yeah, of course, very interesting. OK, Ali, thank you very much for that. Now, we asked you this afternoon to send in your questions about the Omicron COVID variant. Many of you did. Thank you for that. Let's try to get some of the answers then from our expert panel. They are Jeffrey Almond, Visiting Professor of Microbiology at the University of Oxford and advisor to the government's vaccine task force. Also, Dr. Claudia Paoloni, President of the Hospital Consultants and Specialists Association and a consultant anaesthetist, and Ravi Gupta, Professor of Clinical Microbiology at the Cambridge Institute for Therapeutic Immunology and Infectious Diseases. Wonderfully long titles they all have, and we are delighted to see you this evening. Thank you very much indeed. Well, let's get cracking then on some of these questions, starting perhaps with Dr. Paolini, if that's OK. Following on from the Prime Minister's comments, I'm sure you heard them a short time ago. This question from Frank Sandham. Now, he says, in insisting that Christmas will be better than last year and to keep calm and carry on, hasn't the government left themselves nowhere to go if the Omicron variant turns out to be really serious? What are your thoughts on that?
Well, I think it is quite a difficult situation at the moment because we don't know enough about the new variant. But if you were to take a precautionary stance, you really would question whether we should be encouraging people to do too much social mixing. But it is a really difficult situation to judge right now.
Yeah, Professor Almond, what are your thoughts about Christmas, about the restrictions as they stand? We are in this sort of watch and wait zone, aren't we? And it is difficult to make policy.
We are in a watch and wait period until we know a little more about the Omicron and whether it's going to really evade the immunity we've got through vaccination. We've got to be very cautious. And I think at the moment we're trying to sort of balance the response to say, be careful, maintain the social measures, the mask wearing and so on, without a real clampdown. We're all fed up with this. We all want to have a nice Christmas, but this is now here. We've got to deal with it. I think if we learn in the next few days or the next week or so that it is really more severe than we've feared, and it really does escape immunity, I'm sure the government will take even commensurate measures and even tighter precautions.
Yeah, it's interesting, Professor Gupta, isn't it, that this evening we've seen Ireland bring in more restrictions?
Yeah, so the issue here is, of course, that we've learned that once you realise there's a problem, it's often somewhat too late to act because, of course, transmission has gone that much further. It's penetrated the community. The vulnerable in the community, have been exposed to the virus, and therefore it's difficult to bring it under control without really quite extreme measures. So this is the kind of dilemma being faced, and of course the timing couldn't be any worse as we go up to the festive season. But I would say that with an expanded vaccination campaign, and really we could have probably done a better job of expanding vaccinations throughout the age groups and reinforcing boosters in a much bigger way with a sense of urgency over summer when we had the opportunity. And unfortunately, I think we are probably now in a position where we're looking back wondering whether we did enough. So that's just one thing to say. It's not necessarily a criticism, but it's really just a lesson for us all to make gains while we can in this fight against coronavirus. And of course, the use of face covering is absolutely essential to limit transmission of any variant. And that's the key thing about face masks. They don't have to be high tech. They just work, and they can be used by large numbers of people in crowded spaces to good effect, as data have shown. So really, it's up to policymakers to decide what to do. But we do have the tools. We've had the tools for a long time, and really we should be learning from our mistakes.
Yeah, the government, of course, would say that they have set this incredible challenge for the NHS to offer boosters to all adults in just 62 days. But maybe, as you say, it could have been done a little bit earlier. All right, let's move on to our second question. This is from Gillian Walker. I'll get you, Professor Almond, to start off on this one. I have been in the clinically extremely vulnerable group and are now fully COVID vaccinated, including the booster. My question is, will it be safe for me to attend a family funeral service next week, or should I watch the online broadcast? That question from Gillian.
It depends how populated the family funeral is and whether she's confident that other members there are all triply or doubly vaccinated and are cautious. I myself am in a vulnerable group, but triply vaccinated, and I'm just being careful. I will attend a small group of family, but I wouldn't go to nightclubs or busy bars, for example. So I think it's a question of judgment there. If the group is small, you know the people, you know they've recently been jabbed, then I would say you are probably quite safe to attend such a thing. But if it's a big gathering, a lot of people from all over the country, then be very careful indeed.
OK, that's good advice. Claudia, it's interesting, isn't it, the breaking news tonight that over half of UK Omicron cases are in people who have had 2 jabs, this coming from the UK Health Security Agency. 2 vulnerable people, that sort of information does sound alarming, but of course there are loads of caveats, aren't there?
Yeah, it's difficult because also you have to remember that the vaccination program started really early. We did really well with that. So this is why it's so important to get the boosters now, because some of the immunity that will have been achieved through the double vaccinations that people have experienced will be starting to wane. So the best defense that we've got is for everyone to get their booster as soon as possible so that they can reboost that immunity up. So if you're clinically vulnerable or otherwise, you've got more protection than if you wait too long, and especially for all those who aren't vaccinated or those people who've only gone part way, as those numbers shown. That we have a real problem here with the potential, because we don't know enough about the virus, but we've got the problem with the potential of, if it's very transmissible or more transmissible, it will be a numbers game. More people will be infected, which means from our point of view, from staff side in hospitals, they won't be able to come to work because they'll have to self-isolate now with the Omicron. Whether they're double vaccinated, triple vaccinated, it won't matter. They'll have to self-isolate. That will put additional pressure on the hospitals. So we have to really encourage everyone to get that community immunity as high as possible, because that is our best defence for all of us and for the hospitals as well.
OK, well, I've got a vaccine question now. Perhaps, Ravi Gupta, you can have a go at this one. It's from Chris. He says, I've had both first and second vaccine, AstraZeneca he had, and I've had my booster, which was a Pfizer. I'm on immunotherapy. How protected am I from this variant, Omicron, and past variants? Interesting, I was reading, if you've had that sequence, if you've had the 2 AstraZeneca jabs and then a Pfizer jab, that's a pretty good cocktail in terms of fighting the virus.
Yes, so certainly AstraZeneca followed by, or adenovirus vectored vaccine followed by RNA vectored vaccine or delivered vaccine has been shown to give a very good response after the 3rd dose. We don't know how long that lasts, of course, so that's a slight unknown. But yes, you do achieve really good neutralization titers, even though 2 doses of Chadox on their own often lead to slightly lower or somewhat lower neutralizing antibody titers. So it's a difficult question with the immunotherapy. It depends what the immunotherapy is, what it's for, what the underlying immune suppression is. Difficult to give clinical advice on television, so one would have to be careful here and say that it depends on what the immune response is and how severe the immune suppression is. So, and I think this case does highlight an important aspect, which is that we do practice personalized medicine to some degree, and we should be offering patients the opportunity to have their immune response tested in a standardized way, and I think we could do that so that people do understand their risk and their doctors understand the risk. This will be important as we go forward, considering fourth doses, for example, and further types of vaccination as we get more sophisticated. So I think we do need to start having the conversation about individuals knowing their response status earlier rather than later, because it will become an issue later anyway.
OK, very good point. Professor Almond, this is something I've actually been thinking about. I had my booster in the last few days. I've now had 4 jabs this year, 3 vaccines, plus a flu jab. We didn't get a name from this anonymous texter, but they're asking, how many jabs can we actually have? Can we max out our antibodies?
No, I don't think so. When you're a child, you have mumps, measles, rubella, diphtheria, pertussis, polio, and some areas will have hepatitis B and Haemophilus as well. And then as you get into adulthood, you may well have also the papillomavirus vaccine. And when you meet infections, when you catch a cold or you have any other infectious disease illness, of course, your immune response is kicked into action. So there's no limit really to what what you can respond to. There may be limits, but to all intents and purposes, you can respond to many different vaccines. And yeah, none of us want to become pincushions, but I don't think we have to worry about not being able to respond to 3, 4, or 5 or 6 shots.
OK, that's good to know. Very useful. Dr. Paoloni, I suppose on the vaccine issue, we know in South Africa that only about 25% of people have been double vaccinated, and it's interesting that there's been this surge, hasn't there, in people getting COVID multiple times. Why do you think that is?
There could also be the fact that there is a higher HIV population, so they could be immunocompromised as well. So we don't know enough about that detail either. It's a shame that there's only a success rate of about 25% of the vaccination. That will have an impact on its spread as well. So, but again, we don't know how much of an impact on transmissibility being vaccinated will actually protect us for. And that's what we're waiting for, although the initial evidence that came out today would suggest perhaps there is a problem with that.
Yeah. What about 50,000 cases again for the second consecutive day, Ravi Gupta? Are you concerned about that?
Well, we've had case numbers in this ballpark for some time now, and it clearly has had an impact on obviously health services, but also we've lost quite a large number of lives, and we've had a significant morbidity and knock-on effects on other services and ambulance waits, etc., that we all know about. So I certainly am not somebody who thinks that we've had a good run in the last few months, and really we have now perfect conditions for a new variant to seed and expand at a significant rate, and this new variant may be worse for us than the Delta. I should stress, though, that the Delta variant is already able to break through vaccine, and that you can become infected despite vaccination with Delta, and that's potentially because of its very high infectivity, as well as some partial immune evasion. So it's not that the Omicron is doing something completely new. We have seen this before, and therefore, it's not necessarily a very, very bad sign. So it just depends on how much immune function is left over. In other words, which bits of the virus we can still recognize with our immunity and therefore target to prevent progression to severe disease. And I think that with boosting and of course completing vaccination in as many people as possible, we can get to a situation where we minimize morbidity and mortality. The other thing to bear in mind is, of course, the data, you mentioned, of half the people being double vaccinated. Well, of course, in a population which is where the adults are in the vast majority vaccinated, of course, you're going to see new viruses or positive diagnoses in vaccinated people, statistically. So we do need to bear that in mind when we interpret the findings. Of course, we anticipate this is an immune escape virus. We know this has been done before, and so we shouldn't be too surprised that we're seeing it in vaccinated individuals.
Yeah, so you make a very good point. 80% of the UK population double vaccinated, and obviously 50,000 people getting it in a day. The vast majority of them will be vaccinated and won't become seriously ill or indeed go to hospital, which is the good news. OK, another question then, Dr. Paoloni, one for you. If an update to the vaccine to deal with Omicron is developed in the next 100 days, and I've already had 2 vaccinations and the booster, would people like me be required to take a 4th injection as soon as possible, or could we wait till sometime in 2022 for a yearly top-up? That comes from Stephen Lewis.
I think, again, we still don't know enough about the current vaccine, current variant to be able to answer that. I expect we will be needing boosters every year for the foreseeable future. Of course, even if they were able to make and find the new vaccine, which of course they will be, because that's one of the beauties of these new mRNA vaccines, it will be then a production issue of how can you produce it in enough quantity and then distribute it. But I suspect we will all be needing to be boosted in due course, and it may well be next winter, it may well be sooner, but it's too early to judge that yet.
OK, now here's a very good question. This is from Dave in Doncaster. Professor Almond, perhaps you can have a go at this one. Can you have Delta and Omicron together? Can you have them both at the same time?
Absolutely, yes. Your polio vaccine is a mixture of 3. The current flu vaccine actually is a mixture of 4. And some pneumonia vaccines are a mixture of 15. It gets complicated when we get up to those numbers, but certainly you can mix Delta and Omicron together. Now, the danger, of course, is that by the time we get 3 or 4 years down the road, we've gone from 2 to 3 to 4 to 5 to 6, and we've got a complex mixture that we're administering, and we'd rather not do that. The logistics, the manufacturing, the formulation, getting balanced immune responses to each component is quite a challenge, actually. So you'd rather keep it simple. And if the emerging situation is for co-circulating strains, so Delta atop of Omicron, and then whatever comes next, Epsilon or Zeta or whatever it's going to be, if we have to then go to 4, 5, 6, and 7, that is a pretty lousy scenario if they all keep circulating. If some of them disappear, we can drop that one out of the vaccine. But yes, we have the potential to be bivalent, as we say, or trivalent or quadrivalent, and certainly they can be mixed, or they can be administered in separate arms.
Yeah. So when it comes to the vaccine, you could be injected with lots of different variants. But what about actually catching it from 2 different people, one with the Omicron, one with the Delta? Is that possible?
Well, again, that depends a little bit on what the cross protection is one to another. It would be unlikely to get both together. And if you did get both, it's not obvious that you'd be twice as ill, if I can put it that way. But if the strains are sufficiently different, in principle, you could have both at the same time. But that would be quite unlikely. And you'd probably bring them under control with some sort of cross-reactive responses, particularly cellular responses, around the same time.
Brilliant. A very detailed answer for Dave in Doncaster. What about this one? Ravi Gupta, perhaps you can answer this for us. If scientists are still studying the virus's behaviour and do not know much about it yet, how come the British government made the decision to reduce the time needed in between the second shot and booster shots and make them available to anyone over the age of 18 when there isn't enough scientific data available to know if this course of action will work? I mean, that is something that's changed. It felt very rapidly. That time difference between the 2 jabs?
So the answer to that is quite clear, and it's come from some of the big studies conducted in the UK, Israel, and the US, and the data there are that after the dose, the responses, as determined by your antibodies and to some lesser extent T cell responses, do start declining after the second month. So as of 2 months after your second dose, you are in a sort of declining sort of part of your response, and therefore boosting after that 2 months will maintain levels of protective immunity and to prevent that decline. And we know that that decline during high transmission that we have in the UK is associated with greater morbidity and mortality in the elderly in particular. So these declining responses do have a clinical impact in some individuals, and we want to avoid that. So this is information derived from Delta variant infections, but we can extrapolate that we may have a similar scenario or worse still with Omicron. And therefore, I think it's a sensible decision to bring those boosters forward and to vaccinate as many adults as possible, and indeed into the children as well.
OK, fantastic. Well, I feel like we've learned a great deal tonight. So many questions, so many answers we don't yet know, but of course we will get more information as the days pass. But I thank you all very much indeed for your expert analysis. Professor Jeffrey Almond, Dr. Claudia Paoloni, and also Professor Ravi Gupta. Great to see you all, and we appreciate your time this Friday evening. And indeed, thank you to you. If you did email us and text us a question, apologies if we didn't get round to yours. You're watching Sky News Tonight. Coming up after the break, Emma Tustin and Thomas Hughes are sentenced for the killing of his 6-year-old son, Arthur.